Okay, we're here with Irene this morning to discuss how she's been doing in the program. So why don't you give us a little idea of what kind of problems you had when you first came in a few months ago?
I had Hashimoto's. I was diagnosed with Hashimoto's, which was my primary complaint among other symptoms that I had. I did not want to take Synthroid. It was my personal, I didn't want to take any drugs, so I was looking for why I had this and how I could correct it, hopefully naturally. I had a lot of symptoms connected to Hashimoto's. I had anxiety. I had little panic attacks at night.
Right.
I had some fatigue at the end of the day. I had some digestive problems.
Mm-hmm.
I had a chronic lower back problem that had nothing to do with Hashimoto's, but
It was affecting the quality of your life still.
but it affected my life in a huge way.
Right.
Trying to think of some of the other things I had connected to the Hashimoto's.
I think you mentioned numbness in your
I had
hands.
numbness in my hands and a little bit in my feet, and cold. Intolerance to heat.
Yes.
Huge intolerance to heat. So
Okay.
those I think were my primary.
Right. So we ran a number of tests. We did blood tests, we did saliva
Saliva.
testing, we did stool testing to try and find out some of the underlying problems that you had. And we were using diet and nutritional supplements to help correct those things.
Yes.
And here we are a few months later, and now we're trying to find out how are you feeling presently.
It's amazing. I feel amazing. I feel energetic. I have no more panic, no more anxiety, no trembling. You solved my back problem that I had for 12 years. I have to say it's amazing. And in the beginning, when I first started making the dietary changes, I felt a little deprived, but
Yes.
now I feel so great that I don't even want that stuff.
Great.
So I feel good.
Right.
I feel really good. It's amazing.
I don't ask you this question, but I know the answer because you asked your son to come here, and your
Yes.
son lives where?
North Carolina.
North Carolina. He's a patient here.
I felt that you were the only person that could not the only person, but I felt that you could help him. I knew you could help him because you
Right.
helped me.
And
You did.
it's,
He's on the road to recovery after a 5-year disabling problem.
Yeah.
That no one had been to the top universities in the country.
right.
No one could figure out what he had, but
Right.
you
We'll get him on film next time. So, but obviously you would recommend this kind of therapy to other patients
Absolutely.
suffering from similar conditions.
I find this different than any other holistic therapy because you do testing.
Right.
And you get down to the bottom, and we're not taking random supplements.
Correct.
Which you don't need.
Correct.
If you don't have a deficiency.
Right. Okay.
So,
Well, thank you very much.
you're welcome.